Hello and welcome to my YouTube channel. If you are new here, you are very much welcome. My name is Damlola Oyetola and I film about faith, medicine and lifestyle. In today's video, I'll be telling you all that you need to know about polycystic ovarian syndrome. But before I proceed into the video, you know I will do it now. Like this video so that I will know that you want more videos like this. Share this video, subscribe to my channel, and of course I'd like to see your comments in the comment section. So without wasting so much time, let's just go into the video. For the purpose of this video, I'll be calling it PCOS instead of just stressing to say polycystic ovarian syndrome. So basically this video is going to tell you all that you need to know, including what it is, the symptoms, and how to reverse the symptoms of PCOS. All right, so what is polycystic ovarian syndrome? It is a common hormonal condition that affects women of reproductive age group. Women that have PCOS normally have cysts around the outer edge of their ovaries. The ovaries produce hormones like estrogen and progesterone, and also a little quantity of male hormone called androgen. So what happens in PCOS is as a result of hormonal imbalance, where they now have more androgens compared to the female hormone, that's the estrogen and progesterone. So the main features of PCOS would include excess androgen levels, irregular periods, and cysts in the ovary. A lot of women actually have PCOS. According to WHO, about 8 to 13% of women have polycystic ovarian syndrome worldwide. However, in Nigeria, it ranges between 13.8% to 18.1%. About 70% of women with PCOS are actually undiagnosed. That means that they are asymptomatic. What are the symptoms of PCOS? The first I have on my list is irregular menstrual periods, and this could include period not being regular, meaning you don't see it monthly, or you don't even have any period at all. That's called amenorrhea. And some women may find out that they have excessive bleeding during their period. Now, I know a lot of women do not like when it comes to their menstrual period because of the blood loss and you're uncomfortable and all. But please don't just stay home and be happy if you don't see your period. Apart from PCOS, there are also many other causes of a woman not seeing her period. So please visit your healthcare provider, as that's a sign that something is going wrong in your body. Okay. Number 2, abnormal hair growth. Women that have PCOS have abnormal hair growth, and this is called exotism, where they have hair on their face like a man, or even on their chin, on their arms, and also on their chests. Third symptom here is acne. A lot of women that have PCOS also struggle with acne, and it can occur on their face, on their chest, and also on their back. Now, the annoying thing about this acne is they might be difficult to treat. The fourth is obesity. Between 40% to 60% of women that have PCOS also struggle with weight gain and how to lose it. So the next time you see a woman's picture and you want to comment, you're already fat, you don't have to say it. She doesn't need to hear it from you, because the truth is the woman knows. She sees herself and she knows that she's gaining weight, and you don't even know what challenge she's facing as a result of her weight. So please refrain from making your comments. Be kind to people, because you actually do not know what they are going through. The fifth is darkening of the skin. Some women that have PCOS may find out that they have darkening of some areas of their skin, especially around the skin folds of the armpits, the groin area, or even around the neck. Number 6 would be infertility. Quite a lot of people that have PCOS struggle with conception. In fact, like I said, that 70% of women are undiagnosed. So it's when they start struggling with their weight or trying to conceive that the doctor will now do some investigations and find out that they have polycystic ovarian syndrome. So this infertility is because the woman is not ovulating, she's not seeing her period, so there's no way to get pregnant. Now that we know the symptoms of PCOS, what causes it? What makes women to have all these kind of unpalatable symptoms that I have mentioned? Sadly, there is no identifiable cause of polycystic ovarian syndrome. However, some studies have shown that being obese and also genetics have a role to play. So if you have a family history of PCOS, then you may have higher chances of having it. However, some other things have been implicated to cause PCOS. First would be higher level of male hormones, that's the androgens. So women that have higher level of male hormones may have PCOS, and this male hormone is responsible for the male pattern of hair and also the acne that women with PCOS experience. Now, the second thing is insulin resistance. Insulin is an hormone that is produced by by an organ in your tummy called the pancreas. All right. So what the insulin does is it helps to reduce your blood sugar level or blood glucose level. All right. However, people that have PCOS have insulin resistance. That means that their blood sugar is high, and then there's no control system to say let's step you down to normal. So when people start having insulin resistance, it may actually tip them off into having diabetes mellitus. Then the third is inflammation. A study has found out that a lot of women that have PCOS also have some degree of inflammation going on in their body, and that this inflammation may actually lead to production of the androgens that I spoke about earlier. Alright, so to the juicy and I believe the most important part of this video, the solution to this problem. How do you go from having PCOS and struggling with infertility to having your own baby? How do you bring back your period? Like I've said earlier, if you have any of these symptoms, please don't stay at home. It's important to visit your doctor who is going to ask you some questions and request for some investigations like an ultrasound scan and also your hormone profile and other investigations that your doctor thinks is necessary. So how do we manage this? Managing PCOS can be divided into the lifestyle modification and the medication aspect. So let's start from the first one. Lifestyle modification includes losing weight, because like I said, a lot of women that have PCOS also have problems with their weight. According to research, losing just about 5 or 10% of your weight is enough for you to be able to conceive when you have PCOS, and I believe that's a good thing. So how do you deal with your weight? I believe the first thing you want to do is watching what you eat and practicing portion control. And this simply means that you eat what you need and not what you want. You know there's a difference between need and want, right? Need is that's what your body really needs, and then want is just like a top up additional extra stuff that you do not really need. So for weight loss, you eat what you need and not what you want. However, if you are doing this and you feel like you're not seeing results or you're just confused, you don't know what to start, then I'm going to recommend that you see a dietitian. And if you want a dietitian, I will gladly recommend for you. So please leave your comment in the comment section and I'll get back to you. Second part of weight loss is going to be exercise. Exercise will help you to lose weight, but you need to understand that it works hand in hand with diet, because weight loss is just like 20% of exercise and 80% of what you eat. Meaning that if you're going to do exercise, then you need to watch what you eat. Now, exercise has been shown to help to improve your insulin levels and help to deal with insulin resistance. There are other lifestyle factors that you can imbibe. If you are smoking or drinking alcohol, you're going to need to stop, because it's going to be counterproductive. You can't be looking for a baby and then you are drinking alcohol or smoking, which will even affect your baby. So to the medication aspects, the first is combined oral contraceptive pills. So these pills contain estrogen and progesterone. So what it's going to do is it's going to help to bring back your ovulation and bring back your period. So basically regulate your menstrual cycle. Then we have a magical medication called clomiphene. Clomiphene is an ovulation inducing medication. Basically, it's just going to help your ovulation to start. And the amazing thing is, for women that use clomiphene, most of them actually have multiple pregnancies. That means that you can give birth to 2 babies at once or even 3 babies at once. Then we also have androgen blocking medications. Basically, it's going to block the androgen production and reduce the symptoms like acne and excessive hair growth that people with PCOS may experience. Lastly, on medication, we have insulin sensitizing medications. Basically, if you remember, I spoke about insulin resistance. So when you use this insulin sensitizing medication, it will help your insulin to start functioning again as normal. So an example of this is metformin that people that have diabetes use. Then if you have you tried all of this and this does not work, then you may need to go for assisted conception. All right, so this brings us to the end of this video. Thank you very much for watching. And if you have PCOS, I just want to encourage you, keep on going, don't lose hope. It's not the end of the road. I know that it may be hard for you, but don't lose hope and keep on believing in God and do whatever your doctors have told you to do. Okay, if you haven't subscribed to my channel, please do so. Like this video, share with your friends and family, and I would like to see your comments below. Until next time, do stay safe and remain blessed.